Hello friends, welcome to Voice to Nurses. Today we are going to discuss some nursing related MCQs which will help you to get higher mark in all nursing competitive examinations you are going to be appeared. Let's start. First question. Potential adverse effects of surgery and anesthesia are all except potential adverse effects of surgery and anesthesia are all except options: thrombosis from compression of blood vessels or stasis. Option B, malignant hyperthermia or hypothermia. Third option, dehydration and electrolyte imbalance. And option 4, myocardial depression, bradycardia, circulatory collapse. Here the question is, potential adverse effects of surgery and anesthesia are all except. It's a negative question. Exception they are asking. The answer is dehydration and electrolyte imbalance. It is not the potential adverse effects of surgery and anesthesia. Here one thing, malignant hyperthermia. Usually it is occurred due to a general anesthesia. It is a fast increased temperature. Okay, it is a fast increasing temperature which is occur as a complication of general anesthesia. Okay, muscle rigidity also will be occur. Okay, muscle rigidity or muscle spasms will also be occur. Okay, due to increased calcium release. In this, drug of choice is there for malignant hyperthermia. It is known as dantrolene. Okay, the function of dantrolene is to reduce the calcium. Okay. Here the answer is third option, dehydration and electrolyte imbalance. Next question. The extracellular fluid includes the following except. Extracellular fluid includes the following except. Today here is also a negative kind of question. Options. Option first, cerebrospinal fluid and fluid in the intestinal spaces. Second option, fluid within the cells. Third one, blood, plasma and lymph. Fourth option, synovial fluid, pericardial fluid and pleural fluid. Okay, the answer is second option, fluid within the cell. With the term meaning only we can understand this. Okay, extracellular fluid indicate the fluids which are present outside the cell. Intracellular fluids are the fluids which are occurring inside the cell or within the cell. Okay, here the answer is second option, fluid within the cell. So then what all are the intracellular fluids? Water, dissolved electrolytes and proteins. Okay, so extracellular fluids are cerebrospinal fluid and fluid in the intestinal spaces, blood, plasma and lymph, synovial fluid, pericardial fluid and pleural fluid. All these fluids comes under the extracellular fluid category. Okay. Next question. The most common method of microorganism transfer from one person to another in the hospital setting is prevented by. The microbial transfer from one person to another in the hospital setting is prevented by option 1, disinfecting instruments in special solutions. Second option, changing bed linen. Third option, washing hands thoroughly and frequently. Fourth option, filtering air in the hospital. It is a direct question only. The transfer of microorganism from one person to another in the hospital setting is prevented by option 3, washing hands thoroughly and frequently. Hand washing is the primary method to prevent the transfer of microorganisms from one person to another in the hospital setting or wherever we are. Okay. Next question. Wearing seat belts safety helmets and other safety equipments are example of. Wearing seat belt, safety helmets and other safety equipments are the examples of. First option, primary health promotion behavior. Second option, holistic healthcare model. Third option, secondary health promotion behavior. Fourth option, tertiary health promotion behavior. Okay, here the answer is primary health promotion behavior. In this question, wearing seat belt, safety helmets and other safety equipments, all are the things we are using to prevent some kind of accidents or some kind of risk which will get into trouble. Okay, so here it is a direct question. Wearing seatbelts, safety helmets and other safety equipments are the examples of primary health promotion behavior. Okay. Here the answer is primary health promotion behavior. Next question. Considering the chain of infection, a reservoir might be. Considering the chain of infection, a reservoir might be. Options: a contaminated water supply, an infected patient, Staphylococcus bacteria, a tick carrying Lyme disease. Options: a contaminated water supply. Second option, an uninfected patient. Third option, Staphylococcus bacteria. And fourth option, a tick carrying Lyme disease. Here the answer is option A contaminated water supply. Here the answer is option A, contaminated water supply. Actually, the word reservoir is a habitat in which the agent normally lives, grows and multiplies. A causative agent or the microorganism which normally lives in a specific place and it grows and multiplies in that place. Okay, that is a reservoir. Usually, humans, animals and the environment are considered as the common reservoirs. Okay, human, animals and environment. Here, a contaminated water supply which comes under the environment. Okay. Next question. The nurse is attending a patient who has a bacterial pneumonia and is under droplet precautions. Which personal protective equipment will she wear to deliver the meal tray? The nurse is attending a patient who is having what? Bacterial pneumonia and is under droplet precautions. Which PPE should wear the nurse while delivering the meal tray? Option 1, no PPE required. No personal protective equipment required. Option 2, only mask is needed. Third option, special filtration mask and gloves. Option 4, gown, mask, gloves and shoe covers. She is going to deliver the meal tray. So, only mask is needed. Here the answer is second option. Only mask is needed. Okay. Next question. The 3 features of a community. 3 features of a community. First option, physical, mental, social. Second option, primary, secondary and tertiary. Third option, locations, population and a social system. Fourth option, agent, host, environment. Okay, what will be the answer here? 3 features of a community. From the definition of a word community, we can find out the answer here. Community means what? A group of people living in a particular area with the same culture, norms, whatever it is. Okay, same culture, custom. Okay, so from this definition we can find out the answer, right? Here the right answer is third option. Locations, population and social system. Location is a particular area, population is a group of people, and social system. Under the social system, we will say the culture, custom and all. Okay, understood this question? Right. Next question. One of the characteristics of lochia rubra. One of the characteristics of lochia rubra. Lochia means what? It is the discharge from the vagina from the first day of delivery till 28th day. Okay, after delivery. It is known as the lochia rubra. Okay, options will be first option foul odor, foul smell. Second option pink or brown with flesh odor. Third option bloody with fishy odor. And fourth option yellow white. Okay, here the answer. Question is lochia rubra. There are three types of lochia. Lochia rubra, lochia cirrhosa and lochia alba. Lochia rubra, which will be found in 3 to 4 days, from the first day to 3 to 4 days. Lochia rubra. And the special characteristic is like dark red with fishy odor. Fishy kind of odor will be there with the dark red, bloody with fishy odor. For lochia rubra. Lochia rubra will be present in 3 to 4 days with the bloody with fishy odor. Understood? Next one is lochia cirrhosa. So here the answer will be what? Bloody with fishy odor. Next is the lochia cirrhosa. Lochia cirrhosa is the second one. Its color is pinkish brown. Pinkish brown. It will see from 4 to 10 days. 4 to 10 days. The last one is lochia alba. Color is whitish yellow. Whitish yellow. Yellow white or whitish yellow. And it will seen from 10 to 28 days. 10 to 28 days. Do remember this. Lochia rubra is the first one. 3 to 4 days will be there and the color is dark red with fishy odor. Second one is lochia cirrhosa and its color is pinkish brown. It will seen from 4 to 10 days. And lochia alba is the last one. The color will be whitish yellow and it will seen from 10 to 28 days. Okay. Next question. Positive definite sign of pregnancy. Positive or definite sign of pregnancy is options. Option 1, visualization of fetus by ultrasound. Option 2, uterine enlargement. Option 3, amenorrhea. Option 4, quickening. What will be the answer here? The answer is visualization of fetus by ultrasound. During pregnancy, we have a couple of groups of signs are there, no? We are categorizing it into 3 groups. First is presumptive signs of pregnancy. Next one is the probable signs of pregnancy. And third one is the positive or definite sign of pregnancy. Okay. For diagnosis or only we will find these signs of pregnancies in notice. Actually, the presumptive signs of pregnancy are the signs which are felt by the mother. Okay, here you just look here, the amenorrhea. Amenorrhea and quickening, these two are felt by the mother only. Okay, mother can only say, I am not having periods, or I am feeling like something is moving inside my stomach. It will be a baby, it might be a baby or might not be a baby. It might be due to some gastric conditions and all. So it will comes under the presumptive category. And the second is the probable signs of pregnancy. It is observed by the medical practitioner, either nurse or doctor. Okay. which include the common signs of pregnancy, Haga sign, Chadwick sign, Osiander sign, Jacquemer sign, Goodell sign, and all. And the third group is the positive or definite sign of pregnancy. It is the actually diagnosis or definite, what we'll say, it is the positive signs of pregnancy. Okay, compulsory signs of pregnancy. And the answer is visualization of fetus by ultrasound. And heart rate we will see, heart rate we will be checking through the USG and Doppler and all. That also comes under the positive signs of pregnancy. So one video we have prepared previously, and it is in the video list in our channel. Just go through that, okay, for these signs of pregnancy. Next question. The key instructions to be given to the patient and the caregiver with the epilepsy are all except. Regarding an epilepsy patient, some instructions are given here, and they are asking the except a negative question here. Options are, first option, take medications daily. Option B, maintain medication and seizure chart. Option 3, avoid alcohol, smoking, hypoglycemia. And fourth option, take showers in bathtub. Here the answer, take medications daily. Okay, it has to be taken. And maintain medication and seizure chart. It is also mandatory. Avoid alcohol, smoking, hypoglycemia. These are also advisable. And the answer here it is, take showers in bathtub. It has to be preventable. It has to be prevented because it will cause downing. Okay. The amount of air passing into and out of the lungs during each cycle of breathing is referred to as. The amount of air passing into and out of the lungs during each cycle of breathing is referred to as. Options, tidal volume, residual volume, total lung capacity, and vital capacity. Amount of air passing into and out of the lungs during each cycle of breathing, during inspiration and expiration. The one cycle of breathing is one inspiration and one expiration. During this, the amount of air passing into and out. Okay. The answer will be tidal volume. Here the answer is tidal volume. Okay. What will be the normal amount of tidal volume? It is 500 ml. 500 ml is the normal tidal volume. What all are the another options? Residual volume. Residual volume is the volume of air remaining in the lungs after maximum forceful expiration. After maximum forceful expiration, a quantity of air will be remain in the lungs. Okay, that is the residual volume. The normal amount of residual volume will be 1 to 1.2 liters. 1 to 1.2 liters will be the normal residual volume. Next is the total lung capacity, right? Total lung capacity means volume of air in the lungs upon the maximum effort of inspiration. After a maximum effort of inspiration, how much amount of air will be there inside the lungs? That is the total lung capacity. Okay. The total lung capacity for an adult is about 6 liters. Okay. These measurements will vary, okay, according to the age, body composition, and the size of the patient and all. These all are the 1 to 1.2 liters of residual volume, and 500 ml of tidal volume, and 6 liters of total lung capacity and vital capacity. All are measurable for adults only. Okay, adult. The adult value only I have mentioned here. The last option is vital capacity. Vital capacity is the maximum volume of air that can be expired following maximum inspiration. First, maximum inspiration we will take, and after that maximum volume of air we will try to expel or expire. That is the vital capacity. The normal amount will be 3 to 5 liters. Okay, tidal volume, residual volume, total incapacity and vital capacity. Do remember these things. Next question. In rheumatoid arthritis, during the acute phase, significant values are. During the acute phase of rheumatoid arthritis, significant values are. Option 1, ESR and CRP elevation. Option B, RFT elevation. Option C, CBC elevation. And fourth option, LFT elevation. Here the answer is, during the acute phase of rheumatoid arthritis, ESR and C reactive protein will be elevated. ESR and CRP will be elevated. Next question. It's a direct question only. Progressive thinning and shortening of cervix. Progressive thinning and shortening of cervix is defined as. Options: expulsion, dilation, effacement and contraction. Expulsion, dilation, effacement and contraction. Progressive thinning and shortening of cervix is defined as cervical effacement. Okay. Next question. Philosophies of primary health care are all except. Philosophies of primary health care are all except. Options: equity and justice. Next option, intersectoral approach. Third option, primary prevention. And fourth option, interrelationship of health and development. Okay. Answer will be, what will be the answer here? Philosophies of primary health care. Exception they are asking. So here the answer is option, third option, primary prevention. Okay. Actually, primary health care is having 4 philosophies: equity and justice, intersectoral or multisectoral approach, interrelationship of health and development, and the last one is community participation. Community participation. Equity and justice, intersectoral approach, interrelationship of health and development, and community participation. Okay. Next question, the normal levels of sodium in plasma. The normal levels of sodium in plasma. 135 to 143 milliequivalents per liter, 97 to 106 milliequivalents per liter, 90 to 196 milligram per 100 ml, 60 to 100 milligram per deciliter. Here it is a very easy question. Answer is 135 to 143 milliequivalents per liter. When we are studying, the range will be 135 to 145 milliequivalents per liter. Next question. Compression of facial nerve in the temporal bone will lead to. Compression of facial nerve in the temporal bone will lead to. Options: Guillain-Barré syndrome. Option B, Meningocele. Third option, multiple sclerosis. And fourth option, Bell's palsy. Bell's palsy. Okay. Here the answer is Bell's palsy. P-A-L-S-Y. Bell's palsy. Okay. Compression of facial nerve in the temporal bone. Facial nerve compression will lead to Bell's palsy or facial palsy. Let's go to the another options also. Guillain-Barré syndrome. What is Guillain-Barré syndrome? Guillain-Barré syndrome means it destroys the myelin of peripheral nerves. There is a relationship between Guillain-Barré syndrome and multiple sclerosis. Okay, Guillain-Barré syndrome is the destruction of myelin in the peripheral nerves. Guillain-Barré syndrome, destruction of myelin in the peripheral nerves. But multiple sclerosis is the destruction of myelin in the central nervous system. Okay, myelination or demyelination or myelin destruction in the central nervous system happens inside multiple sclerosis. In the peripheral nervous system happens in the Guillain-Barré syndrome. In this Guillain-Barré syndrome, ascending paralysis will be occur. Ascending paralysis means what? The paralysis travels up the limbs from toes and fingers towards the torso. Okay, towards the upper body. Understood this one? And one more an important thing is there, right? Inside the Guillain-Barré syndrome, a rare variant of a syndrome is there. Miller-Fisher syndrome. Miller-Fisher syndrome. It is a rare variant of Guillain-Barré syndrome which usually present with descending paralysis. Okay, usually under Guillain-Barré syndrome we will notice ascending paralysis. Inside this Guillain-Barré syndrome, a rare kind of syndrome is there, that is known as what? Miller-Fisher syndrome. In this Miller-Fisher syndrome we can notice descending paralysis. Descending paralysis means what? Center to periphery. Okay, understood this? Next, one more option is there. Meningocele. Myelomeningocele, spina bifida. These all are we are here, these all are comes under the neural tube defects. Okay, neural tube defects actually it will occur within the first month of pregnancy, right? Due to folic acid deficiency. Meningocele means what? Meningocele, under this meningocele, a sac that pushes through the gap in the spine with the spinal fluid. Okay, without spinal cord. Okay, it is a sac that pushes through the gap in the spine. Okay, there will be a gap in the spine. Through this, a sac will be pushed out. Inside that sac, spinal fluid will be there, that is CSF will be there, but the components of spinal cord or elements of spinal cord or nerves will not be there. Okay, so the nerve damage will be less or no, right? Then the myelomeningocele, actually it is the more complicated one. Same as this meningocele, a sac will be protruded through the gap in the spine. Inside that sac, spinal cord, the elements of spinal cord will be there, CSF will be there, and nerves are there. Okay, so the nerve damage will be more, right? Along with these words, meningocele and myelomeningocele, one word will also be here, spina bifida. Okay, spina bifida occulta and spina bifida cystica are also there. In this spina bifida occulta, the contents will be protruding out, right? In this spina bifida occulta, the symptoms will not be experienced as visible. Okay, there is a thin line of skin will be there over the sac or the components. Okay, in this spina bifida cystica, it is a more severe form of spina bifida that causes a visible cyst or a fluid-filled sac on the lower part of the baby's back. In this spina bifida occulta, no visible symptoms will be there, but the one protrusion is there with the thin layer of skin covering. But in spina bifida cystica, there is a visible cyst, fluid filled sac will be present on the lower back of the baby. Okay, understood these things? Do remember. Okay. Next question. Inborn errors of metabolism are all except. Inborn errors of metabolism are all except. Options: cystic fibrosis, phenylketonuria, Tay-Sach's disease, Turner syndrome. Cystic fibrosis, phenylketonuria, Tay-Sach's disease and Turner syndrome. Here the answer is Turner syndrome. Turner syndrome is an X-linked disease. X-linked disease, I mentioned here, it means like it is due to what? Mutation. Okay, due to this mutation and all, what will cause a female with the only one X chromosome will present. A female baby will be born with the only one X chromosome. Okay, baki all cystic fibrosis, phenylketonuria and Tay-Sach's diseases are all comes under the metabolic inherited disorders. In this, the option A, cystic fibrosis, is an inherited life-threatening condition that damages lungs and digestive system. It affects the cells that produce mucus, sweat and digestive juices. It causes these fluids become thick and sticky, then plug up tubes, ducts and passages. Usually cystic fibrosis causes a sticky appearance or sticky nature inside the tubes and all. It will cause what? If it occur inside the digestive system, it will cause what? Sticky mucus or sticky fluids inside the digestive system. And in lungs also it will cause what? Dyspnea and all, difficulty in breathing and all it will cause. Right, it is a life-threatening condition, cystic fibrosis. Next is the phenylketonuria. Phenylketonuria is also an inherited disorder that causes a buildup of phenylalanine. Increased amount of phenylalanine will be there. It is an essential amino acid. Usually a material phenylalanine hydroxylase is needed to break down the phenylalanine. Due to this phenylketonuria condition, it will not produce what? Phenylalanine hydroxylase will not produce. Okay, after this what will occur? The breakdown of phenylalanine will not be occur. It causes the buildup of phenylalanine in the body. Okay, it is the main thing in the phenylketonuria. Next is the Tay-Sach's disease. Tay-Sach's disease is also an inherited disease. It is a rare disorder caused by an absence of one enzyme that helps break down fatty substances. Okay, it is due to absence of an enzyme that helps for the breakdown of fatty substances. These fatty substances are called gangliosides. Okay, these fatty substances are called gangliosides. These gangliosides build up to toxic levels in the brain and the spinal cord and affect the function of nerve cells. These all are the options. From these, first, second and third, cystic fibrosis, phenylketonuria and Tay-Sach's disease comes under autosomal recessive disorders. Autosomal recessive disorders. Okay. Next question. The most significant characteristics experienced by person with depression. Most significant characteristics experienced by person with depression. Options: aggressive, abusive or violent behavior. Second option, hypervigilant and nightmares. Third option, lack of impulse control. Last option, depressed mood and loss of pleasure or interest. It is a direct question only. Significant characteristic of a depressive patient is fourth option, depressed mood and loss of pleasure or interest, hopelessness. Okay. Next question. The elderly individual is at greater risk for dehydration. Elderly individual is at greater risk for dehydration than the middle-aged adult. Because options, the elderly has more muscle mass. Second option, elderly drink little fluid. Third option, compensatory mechanism works less efficiently. Fourth option, their bodies are almost 80% water. Okay. What will be the answer here? Middle-aged, when compared to the middle-aged people, elderly individual is at greatest risk for dehydration. What will be the answer? The answer is compensatory mechanism works less efficiently for elderly individual. Next question. False labor manifestations are all except. False labor manifestations are all except. Option. First, contraction lessens with activity or rest. Second option, cervix progressively effaced and dilated. Third option, abdominal discomfort, contraction irregular is the last option. Okay, irregular contractions is the last option. So what will be the answer here? False labor manifestations are given here. One except one point is there. That we have to choose. What will be the answer here? Contraction lessens with the activity or rest. It is a manifestation of false labor. Abdominal discomfort. It is also. Next is the contraction irregular. Irregular contractions also comes under the false labor. Cervix progressively effaced and dilated. Progressive effacement and dilation of cervix occur only in the true labor. Okay, for false labor, how we will recognize it is a false labor or a true labor? For false labor, as it is mentioned here, contractions will be irregular. It will lessens with activity or rest. Okay, and it felt in the abdomen only. While in the true labor, for true labor pain, the abdominal pain will radiate to back and lower leg or thighs. Okay, in this false labor, the abdominal discomfort will only be there around the umbilicus and all. And in false labor, show will not be present. Show will not be present. And cervix changes will not be there. Cervix effacement or dilatation will not be there. And almost all the time, fetus will be bellotable. Okay, bellotable fetus will be there. Okay. Next question. The following are the important preoperative nursing airs for a patient with the benign prostatic hypertrophy. Nursing airs, preoperative nursing airs of a patient with the benign prostatic hypertrophy except options, hormonal therapy. Option B, assure nutrient and correct fluid and electrolyte balance. Third option, promoting urinary drainage. And the last option, acid diet to treat infection. Assure nutrient and correct fluid and electrolyte balance, promoting urinary drainage, acid diet to treat infection. Here the exception question, negative question, except the preoperative nursing care. The answer is first option, hormonal therapy. It will not come under the preoperative nursing care. Okay. Next question. The person who becomes short of breath with little exertion, such as when eating a meal, has what kind of respiratory problem? Patient is having what? breath with little exertion. Shortness of breath with little exertion. Option Cheyne-stokes respiration. Second option dyspnea. Third option hyperventilation. And the last option stridor. Shortness of breath with little exertion. Simple question. Answer is dyspnea. Okay. When we are going through the another options, first option is what? Cheyne-stokes respiration. Cheyne-stokes respiration is an oscillation of ventilation between apnea and hyperapnea. Okay. It is a combination of apnea and hyperapnea. Okay. Next word, hyperventilation. It is a rapid and deep breathing. Rapid and deep breathing is the hyperventilation. Hyperventilation will cause what? In respiratory system, when we see this ABG analysis, what will cause for a hyperventilation patient? Respiratory alkalosis. Respiratory alkalosis, because rapid and increased depth of respiration, rapid and increased respiration will be there. Deep breathing, rapid and deep breathing will be there. So excess amount of carbon dioxide will lose from the body. So it will cause alkalosis, respiratory alkalosis. Hypocalcemia will also be there during hyperventilation. Okay. Next is what? Stridor. Stridor is the high-pitched wheezing sound. High-pitched wheezing sound. Okay. Then go to the next question. Reye syndrome is associated with. Options are hemolytic transfusion reaction. Second option, biliary colic. Third option, sickle cell crisis. And the last option, use of aspirin with the viral illness. Okay. Here the answer is fourth option. Use of aspirin with the viral illness. Reye syndrome is actually a life-threatening condition, and it is usually observed in children. Okay, from 4 to 12 years of age and all. And it is due to a use of aspirin with the viral illness. Okay. Next question. Apgar score is considered excellent if it is. Apgar score is considered excellent if it is. Option 4 to 5. Second option 3 to 7. Third 0 to 3. And fourth 7 to 10. Everyone knows this. Apgar score is considered excellent if it is 7 to 10. If 3 to 7 to 10, we will say it is an when the score will be in 0 to 3, it mentions as severely depressed. And if the score is in between 4 to 6, it is moderately depressed. Okay, 0 to 3 severely depressed, 4 to 6 moderately depressed, and 7 to 10 excellent condition. Next question. One cardiac cycle completes in. Option 0.57 seconds, 0.9 seconds, 0.8 seconds, and 0.1 seconds. Answer is 0.8 second. Phototherapy is indicated for children with. Next question is phototherapy is indicated for children with hemolytic disease, necrotizing enterocolitis, hypoglycemia, and hyperbilirubinemia. Here the answer is hyperbilirubinemia. For babies with bilirubemia, we will give phototherapy. Hyperbilirubinemia is of two types, physiological and pathological. Physiological jaundice and pathological jaundice. Pathological jaundice will be there within 24 hours of delivery. Okay, after the delivery, within 24 hours, first 24 hours, we can see the pathological jaundice. The treatment for pathological jaundice is blood transfusion. And for physiological jaundice, usually it is seen in 24 to 72 hours. The treatment is phototherapy. Next question. Artificially acquired immunity is obtained by. Artificially acquired immunity is obtained by. Options: recovering from a disease. Option B, exposure to a disease. Third one, being breastfed. And fourth one, immunization with the antibody response. Artificially acquired immunity. Okay, immunity is classified into several classifications. Simply the natural and acquired immunity are there. Natural and artificial immunity are there. Natural immunity, natural passive and natural active immunity is there. In natural passive immunity, an example is breastfeeding, being breastfed. Okay, antibodies and all we will get through breastfeed is the natural passive immunity. Next is the natural active immunity. Natural active immunity we will get after getting an exposure to a disease or recovering from a disease. So here the answer will be what? Artificially acquired immunity will comes in the immunization with the antibody response. One more is there, anti-zera and antitoxins. These will comes under the artificial passive immunity. Okay, artificial passive immunity is the anti-zera and antitoxins. Next question. The drug of choice to treat bulimia nervosa. Drug of choice to treat bulimia nervosa. Options: benzodiazepines, antidepressants, thiamine IV glucose 10%. Here the answer is antidepressants. Drug of choice to treat bulimia nervosa. Answer is antidepressants. Example: SSRI, selective serotonin reuptake inhibitors. Under selective serotonin, it is a type of antidepressant which comes under the reuptake inhibitors group. Okay. This selective serotonin reuptake inhibitors will inhibit only reuptake of serotonin, and it will causes the increased serotonin in synapse, and it will stabilize our mood. Okay, in this selective serotonin reuptake inhibitor is known as the drug of choice for depression and neurosis like OCD, obsessive compulsive disorder, PTSD, post-traumatic stress disorder, phobia and bulimia. Okay, some examples are citalopram, sertraline, paroxetine and fluoxetine. Fluoxetine is the best drug of choice for antidepressants or for depression. Okay, citalopram, sertraline, paroxetine and fluoxetine. Benzodiazepines we usually give for the patients with the anxiety disorders. A drug of choice is there for benzodiazepine overdose. It is known as flumazenil. And injection thiamine IV. Usually we will give this for the patient with alcoholic withdrawal syndrome to treat Wernicke's encephalopathy. Okay, IV glucose 10%. Everyone knows that to treat hypoglycemia we will give. Okay, let's stop this session. Thank you for watching this video. If it is useful for you, share with your friends and please do subscribe this channel. Thank you. If any